Hi, everyone. We are back for the week 2.4 instructor lecture, where we need to fully grasp the effects of massage on certain neurological pathologies. This is part 2. I'm sorry for how long part 1 was, but everything I talked about on there, I have seen on MBLEX questions. All right. The quiz doesn't fully cover everything I highlighted and tried to point out in the lecture part 1. So I highly suggest you look at the PDF or actually listen along. I know it's a lot of information to take in. That's the cool thing about this. You don't have to look at the visual along with this. You can just put me on in the background while you're cleaning a room or something so that you hear that information and get it in your brain to get ready for the MBLEX and to help all of your future clients that might be exhibiting symptoms of these neurological pathologies. All right. So today, we're going to cover part 2, and we're going to cover neurovascular disorders, infectious diseases, intervertebral disc disorders, which is super common, and peripheral nerve disorders, which is also common as a side effect or symptom of other pathologies like diabetes. All right, here we go. Neurovascular disorders is where we are going to start. The first thing is a TIA, which is a transient ischemic attack. All right, remember the word ischemia, ischemic. I'm going to go ahead and highlight that for you. Ischemic means a lack of blood flow. All right, so in the case of an ischemic attack, it only lasts from seconds to hours with the symptoms gradually subsiding. This is a complete recovery attack within 24 hours. This is when you have a thrombus, all right, which is like a blood clot within a cerebral artery, or an embolus, which is a floating mass, such as a blood clot. Although the image down here honestly looks like a ball of lipids, all right, like a ball of fat or plaque, which travels to the brain. All right, it has breached the blood-brain barrier. It's in there, and it causes a temporary blockage of blood flow to the brain. Lord, say that like 10 times fast. All right. Your signs and symptoms differ depending on the portion of the brain that has been affected by this. All right. Massage is appropriate for people who have had a TIA because usually you are massaging them after the attack has passed because they fully recover within 24 hours. If you see someone exhibiting signs and symptoms, like tingling, burning down one side of the body, and they have sudden weakness, they have difficulty understanding people, they might have sudden blindness, garbled speech, which is aphasia, if they can't remember or say certain words or can't understand certain words, that is aphasia. Please definitely call 911. If an attack lasts longer than that period of time, and we have a sudden disruption in cerebral blood flow, either from an occluded or ruptured blood vessel, this could be a much more extreme. That's a hemorrhagic stroke, which we'll get to in a moment. It is a stroke if it lasts longer. All right. TIAs resolve within 24 hours. Strokes have longer lasting damage, and the damage is continuing longer. We don't just have a single blood clot that got stuck and then moved. In this case, we have an open brain bleed, or we have a blockage that's not moving. All right. Ischemic strokes are about 87% of the cases, again, caused by a thrombus or an embolus. These are known as thrombotic or embolic strokes. All right. As the thrombus enlarges, it gradually narrows the arterial lumen until it's partially or completely blocks the blood flow. And then all that brain tissue doesn't get any oxygen. All right. A cerebral embolism is also a blockage, but it's caused by an embolus, like we saw on the previous slide. With hemorrhagic strokes, the artery actually ruptures, flooding the tissue with blood, causing tissue damage, and then pressure will build inside of the skull because we have all of this blood filling it. There's new liquid being added that shouldn't be there in the brain. Since hemorrhagic strokes spread and all of that fluid is going everywhere and we're causing swelling in there, it involves a larger portion of the brain, what affects more functions of the body. And so these strokes are way more severe. Left-sided brain damage results in right-sided paralysis and vice versa. Strokes are also called cerebrovascular accidents, cerebral infarctions, and brain attacks, which honestly I hadn't heard before this book, but it's now my favorite saying. It's like the movie Mars Attacks, but it's brain attacks. One super cool thing, neuroplasticity really slows down after age 26. All right. That's a term that's a throwback to 115, right? To our advanced anatomy class. Neuroplasticity. Some stroke victims develop new neural pathways or can relearn previous tasks because the brain can create new pathways for the nerves to communicate with each other. This is called neuroplasticity. Super cool. Now, you can perform a massage during the rehabilitation process. Just like part one, we need to inquire about positions that are comfortable. We might need to get creative with how our clients are laying down. You need to use slow, light pressure, gentle passive range of motion, and they do suggest hydrotherapy to improve treatment outcomes. There is some research on the next page to help you out with that. But again, no forceful passive range of motion in case they've been inactive for long periods of time, because we're concerned about reduced bone density. Also, stroke victims very often have difficulty communicating with speech after the event, so make sure that you have a clear communication system set up with your client. All right, here is some awesome research for you that is available when you look at the PDF of this lecture. All right, and I also have stroke and first aid. Please, please look at this, all right? The acronym FASTER, check out their face. Does one side of the face droop and smile unevenly? Can they raise both of their arms? Does one arm drift downward or is immobile? Stability, do they have trouble standing upright or walking? Talking, ask them to say a simple phrase, such as, the sky is blue. Is the speech slurred or are they difficult to understand? Do they not understand what you're saying? Eyes, does the person have difficulty seeing out of one eye or one side of the room? Do they have double vision? And then react. All right. If any of these things are an issue, please call 911 immediately. Again, the acronym is FASTER: face, arm, stability, talking, eyes, react. Infectious diseases. Meningitis. Woo! Meningitis is an inflammation of the meninges. Remember, that's the membrane covering the brain and the spinal cord. Meningitis usually occurs as a secondary infection after like a respiratory tract, ear, or dental infection. 25% of people with meningitis either get permanent brain damage or die. All right. It is characterized by a generalized throbbing headache, which becomes severe, chills and fever, sensitivity to light. That all sounds like the flu, right? So be careful, or the beginning of sepsis. But here is a super important distinction with meningitis is that you get a hyperextended stiff neck called nuchal rigidity. So one of the tests that you could do to see if someone might have meningitis when they're experiencing these long-term headaches, they're coming to see you because they just think they're super stressed. See if they can touch their chin to their chest, or if their neck is so rigid they can't bend it downwards. All right. They may also have on their skin, you might notice a petechial rash. We're going to cover petechia when we talk about the integumentary system later on. But check out this image down here in the bottom right corner. You see all this red spotting. Sometimes you'll see it up in this region. Hopefully you can see me on the video, all up underneath the eyes if someone has been forcefully coughing, people with bulimia that are constantly making themselves vomit sometimes have petechia in this region. That is from the pressure, but people with meningitis will have petechial rashes all over. The headache is real. I actually had meningitis and didn't realize it when I was a spa director in Florida. I had an ongoing headache. I didn't know if I was allergic to a new product that we had at the spa, or I was just really stressed and dehydrated because I was living off of coffee for about a month. But I had a nonstop headache, and my assistant director finally convinced me just to go to the hospital to get checked out after work one day, and lo and behold, I had viral meningitis, and they put me in quarantine, which leads us to treatment. People with meningitis are usually hospitalized. I wasn't only hospitalized, I was put in the special sealed room. The most common treatment for meningitis is antivirals or antibiotics. Or it could be anti-seizure medications if they're going through that. Massage is postponed until the client has completely recovered, and that is absolutely the case in this, especially if you're in quarantine. No one's getting near you. This, if it's bacterial meningitis, it is very contagious, and you definitely don't want it passing on to people because it can cause permanent brain damage or be fatal. Encephalitis is inflammation of the brain characterized by cerebral edema. All right, we have swelling in the brain, we have inflammation in the brain. A co-infection of meningitis is always present. So hopefully you could see my cursor moving around this little section here. This is where your meninges are, all right? And then, of course, they surround your spinal cord too, but they're up around here. So if you have encephalitis, there's swelling here, but you already have swelling all around here as well. You're having a very bad time. Excuse me, encephalitis can be gradual or have a very sudden onset, and can be absolutely life-threatening. The mild signs and symptoms include fever, headache, stiff neck, and restlessness. All right. So, kind of like the flu, but then we've got that stiff neck from the meningitis. More severe signs include vomiting, muscular weakness, drowsiness, visual disturbances, mental confusion and disorientation, seizures, and even coma. Massage is clearly postponed until you have recovered from this. Poliomyelitis and post-polio syndrome. So poliomyelitis or polio is a contagious infection that is now rare. I had to cross this out because it says in the United States the last case of naturally occurring polio was in 1979. We actually had a case of polio in 2022 in New York, and there was another instance of polio in 1993. I believe there's been a few others. It is transmitted by direct contact, causing selective destruction of motor nerves. Very terrible. Absolutely terrifying. We did absolutely pretty much eradicate it due to vaccinations. I know during the COVID pandemic there, people were becoming very, very vocal about vaccinations and not wanting to do vaccinations, uh, which included not just the COVID vaccine, but it spread to other vaccinations. And now, as recently as 2022, we have polio reoccurring. There's also been cases of Ebola and stuff, but I am now sidetracked. I apologize. Please, but as your pathology teacher, I highly recommend that you look into the instances of infectious diseases and vaccinations and what is happening in your regional area. What is post-polio syndrome? PPS is a collection of symptoms seen in individuals who had previously recovered from polio or who were misdiagnosed at the time, but are now considered to have the infection. All right. Massage and poliomyelitis or post-polio syndrome. So you're unlikely to encounter people who have polio. unless you live in New York now. But massage is postponed until the person has completely recovered. It is contagious. Anything that's a contagious infection, you do not massage until the client is completely recovered. Now, once they are recovered, you're probably going to have to elevate their upper body because they usually experience shortness of breath, and you need to do massage with light pressure. A lot of times they will have cold intolerance, so provide comfort measures like a blanket, an electric table warmer, raising the room temperature, or like some combination of those. Intervertebral disc disorders. All right. These are pretty common, and this is a huge cut of the massage therapy industry, things that we work on, especially if you are going to partner with someone like a chiropractor, an orthopedic surgeon. You know, you will hear piriformis syndrome symptoms, which are usually sciatica symptoms, and low back pain more than almost any other problem in your office if it is, um, running like a normal massage office. Let me put it that way. Degenerative disc disease is degeneration and deterioration of the intervertebral discs. All right, we're talking about those spongy donuts in between your vertebrae in your spine. Changes occur to these over time, causing pain and dysfunction. They can herniate, they could bulge out, they can cause things like sciatica. You can have osteoporosis causing issues in the spine, spondylosis, spondylolisthesis, scoliosis, spinal stenosis, or narrowing of a passage where the stenosis is coming in and you're getting like a bone overgrowth that is now pinching in or making that foramen smaller and squeezing in on the nerve. You can also have squeezing in the central canal, pinching your whole spinal column rather than just the intervertebral foramen, which will be closing down like on that sciatic nerve. All right. 1/3 of people aged 40 to 59 years old have it. Mrs. Ellis has it. Degenerative changes of the intervertebral discs are a result of the aging process. And over time, discs slowly begin to dehydrate and narrow and may break down. I would also argue that dehydrating yourself and chronic use or overuse is also an issue. You see this a lot more in people that have manual labor positions, things of that nature. They're going to have more degeneration than someone that has been exercising and stretching properly and not overusing or underusing their body. So it might be asymptomatic to extreme pain, all the way to paralysis. It really just depends. A lot of times, pain is worse in a particular position because that nerve becomes compressed or impinged, sometimes in a sitting, lifting, or twisting or bending position. With massage and degenerative disc disease, all right, pay close attention to how comfortable the client is. You might have clients that can't raise their leg to get on the table. You might have to lower your table and provide a footstool. Position the client for comfort. All right, you might have to be in a weird side lying with like a bolster under a knee. All right, you might have to put bolsters in between the knees while they're side lying. If the client has osteoporosis, reduce bone stress by decreasing the amount of applied massage pressure. Light pressure. No forceful passive range of motion to the spine or hip. We do not want to move those discs around. So herniated discs and bulging discs. Here's an image here of where a disc might be bulging out and pushing in on the spinal cord or on peripheral nerves here. It is a protrusion of the center of the disc. This is also called a slip disc. It starts occurring, it's nice and popular around age 35 to around 60, usually your most active labor years. All right. Massage in herniated discs is the same as degenerative disc disease. Pay attention to their level of comfort. All right. If they have severe pain while doing basic tasks to get onto the massage table, it might not be the best day to do it, or they may not be the best candidate to suffer through a massage. This is a really important point to remember here. All right. Muscle spasms along the spine for people that have slipped or bulging herniated discs. Muscle spasms along the spine might be serving a protective purpose and maybe holding some of that spine in place. So if someone is coming to you complaining that they want a massage because their back keeps spasming and really, really hurts, make sure that you convey to them, and also make sure that you put in your SOAP notes that you documented this and spoke to them, that you can work on their back to calm those spasming muscles. However, if the body is doing that as a protective measure, those spasms are going to return shortly after the massage treatment because the body is doing it as a protective mechanism, and it's not something that you can relax out like general muscle tonicity. All right. There are orthopedic physical tests that you can do for these. You're definitely going to cover those in your upper and lower, mostly your upper palpation courses, but I have them in here for you, how to do them. If you would like to do so, please download the PDF or just pause the lecture to read through this. All right, I have them available for you. Now, sciatica piriformis syndrome is pain radiating down the path of the sciatic nerve. You see this yellow line here. It can come a variety of ways. It's different in a lot of people. Sometimes it goes through the piriformis. Sometimes it goes around it, above and below it. Sometimes it just goes underneath it. It really just depends. A lot of people don't truly have the whole nerve only going through the piriformis muscle, which would be piriformis syndrome. However, tightness in this area will cause impingement, whether the nerve is fully going through this muscle or not. Usually you'll have radicular pain that radiates originating in the lower back. It goes into the buttocks through the side of the buttocks, all right, that you will feel it there. And then you'll have muscle weakness, difficulty walking. You'll have some stability problems. You could have tingling, you could have pain, and this can radiate all the way down to your toes. All right. Again, this is another symptom where muscle spasms along the spine and possibly in the butt cheek on the side, like close to the piriformis muscle or glute max or glute med, might be spasming to help protect. This again has orthopedic tests like the straight leg raise test, and I have those for you. All right, here's some more in-depth information about massage, but we did cover this in a lot of detail in 115 with those sciatica treatments and videos that we went over. If this is something that you're interested in, we can definitely deep dive. But for now, please know that you need to do gentle decompression and traction techniques for this, and we're going to move on. All right, here's a straight leg test. Peripheral nerve disorders. Trigeminal neuralgia. We're going to start with this one. Trigeminal neuralgia is characterized by excruciating episodic pain in the areas supplied by the trigeminal nerve or cranial nerve number 5. All right, the trigeminal neuralgia is the trigeminal nerve or cranial nerve number 5. All right, it's also called tic douloureux. All right. Attacks can be spontaneous and triggered by mechanical stimulation, like touching the face while shaving, chewing, drinking, speaking, brushing your teeth. It tends to be progressive, causing longer and more frequent bouts of intense pain. With the quote here, the pain is so severe that people with trigeminal neuralgia are, quote, begging to be killed, end quote, to be put out of their misery. And suicides with this condition are not uncommon. The pain is so incredibly intense. Possible causes are compression of the trigeminal nerve by tumor or vascular lesion. Sometimes it is caused by preceding disease like MS or shingles. All right. It is usually unilateral. Remember, that means on one side, unilateral, lateral meaning the side, uni meaning one. It's unilateral, and it follows any or all parts of cranial nerve 5. All right. It usually lasts seconds to several hours. It varies. It doesn't last for a whole day, thank goodness, but it can last for several hours. During severe attacks, just postpone the massage. Otherwise, treat the face and scalp as a local contraindication because massaging these areas can trigger an attack in susceptible people. Avoid pressure on these areas from the massage table or accessories as well, such as the face cradle. You don't want the weight of their face pressing in on that nerve whatsoever. Now, there's also Bell palsy. This is cranial nerve number 7, or the facial nerve. Bell palsy is also a unilateral issue. It is a sudden facial paralysis in areas supplied by cranial nerve 7, or the facial nerve. They may last a few months, these symptoms, or they may be permanent. It's usually first noticed in the morning because it usually develops overnight. Now, unilateral facial paralysis is often signs of a stroke, but you won't have the other issues with this, like arm immobility or instability, that you would with a stroke. Symptoms can be mild to severe. Sometimes people are unable to smile, whistle, grimace, or control salivation. If you have someone with Bell palsy, again, my little washcloth suggestion, towel on the floor for drooling. They may not be able to help that at all on the effective side. They may also have problems with eating and drinking because they'll be unable to close the mouth on that side. All right. Massage techniques such as quickly applied effleurage directed upward on the affected drooping side, all right, might improve facial symmetry. I would look up quick lymphatic drainage techniques for the face as well. Those type of techniques do tend to help people with Bell's palsy. You should learn ways, if you're interested in this, there are techniques that you can do to specifically address this condition. But before you do this, obviously obtain permission before applying facial massage because they may feel self-conscious and not want their face to be touched. All right, but do recommend, it says instruct here in your book. This is pulled from your book, but I do not ever tell you to instruct. You should always recommend or suggest. All right. Suggest that the client massages his or own face 2 to 3 times a day. Myasthenia gravis is an autoimmune disease that affects the acetylcholine receptors, causing disruption of motor nerve transmission and causes reluctant muscle weakness. All right. Muscles of the eyes, mouth, throat, and neck are usually affected, and the face may falsely express sadness, and attempts to smile may result in a strange snarl. Vision becomes impaired, speech slurs to a nasal monotone, the head droops forward because of weak neck muscles, and fatigue is often a frequent complaint. Use light pressure when massaging these clients, and of course, avoid forceful passive range of motion if they've been inactive. All right, Guillain-Barré syndrome. Here we go. This is a rare, so you should not be seeing it in the office, most likely. Rapidly progressing autoimmune disease resulting in demyelination of the peripheral nerves. All right, so if the nerve cell body remains alive through the acute period, This is cool because this isn't like the central nervous system. The peripheral nerves can regenerate. All right. If they can regenerate, some of that motor function can come back. If it doesn't regenerate, then motor function will be lost and the person can experience varying degrees of disability. It is an autoimmune response. It is thought to be caused either as a response to a viral infection or potentially to immunization. It begins as unexplained tingling in the hands and feet, followed by general muscle weakness. If swallowing or breathing becomes involved during the disease progression, the condition becomes life threatening and the person will require a mechanical ventilator or breathing machine. Massage is absolutely postponed until this person is in recovery. All right. Do not massage someone that has this, that is in an exacerbation period. All right. Where they're getting progressively worse. This is almost guaranteed to be from diagnosis onwards. It is going to be very rare that you're going to encounter this, but please be aware of what it is for your MBLEX exam. Peripheral neuropathy, this is one you're going to see quite frequently in the massage office. This is damage to the peripheral nerves from disease, medications, or other reasons causing paresthesia, muscle weakness, and pain, usually in the hands and feet. All right. These can be complications of diabetes, HIV, chemotherapy can also cause this. You can have kidney failure, vitamin deficiencies, like if you're really shy on B12, this can happen. And also exposure to a lot of heavy metals can cause this. Symptoms almost always begin in the distal body regions, all right? So, like, see how it's highlighted in red down here? The hands and feet. And then they start to progress and travel proximally. So it's going to travel up the limbs towards the torso of the body. Now, you can perform massage over areas of neuropathy. I know a lot of times, right, when you're beginning, they're like, never touch the feet of like diabetics, but you can use light to moderate pressure. You need to talk to them and you need to inspect your client's body. You need to inspect their feet, especially if they're diabetics. Look for sores, broken skin, objects embedded in the foot. Your clients might not be aware at all that they have foot ulcers from the pressure or shearing forces that are applied to the foot while walking or doing things with any type of pressure. And your clients won't know it because they don't have any sensation. They cannot feel the pain in their feet. So encourage your clients to do a daily self evaluation, especially of their feet if they have peripheral neuropathy. I would recommend using a soft rather than a stiff bolster behind the knees. All right, so we're not doing any nerve impingement or any pressure on any nerves in that popliteal region. All right, we know that that's an endangerment site. That's an area of caution is behind the knees. With people with peripheral neuropathy, you want to use a very soft bolster. Do not use hot packs and hot stones because you can potentially give them contact burns because they won't be able to tell you that it's too hot and that it needs to be moved. A side note on hot stones, I have seen new therapists pick them up with tongs. That's understandable if you don't want your hands in the water to get them if you're doing them in something like a crock pot, but you should be dropping that stone in your hand before it goes on the client's body to check that temperature, all right? To make sure that you are not putting something overheated on that client's skin. Here's some research for you on that. And now we are going to talk about thoracic outlet syndrome. This is more common than what you would think. Thoracic outlet syndrome is a group of disorders caused by compression of nerves or blood vessels. All right, your neurovascular bundle located in the space between the clavicle and the first rib. This space is also called the thoracic outlet. There are several types of TOS, and that includes neurogenic and vascular reasons for getting these issues. Neurogenic is when it's affecting the brachial plexus with an injury, and this involves compression of the brachial plexus and is usually the most common type of thoracic outlet syndrome. Vascular involves compression or one or more of the arteries or veins. It is the least common but much more severe type of thoracic outlet syndrome. You could have an anatomical defect that causes this, or poor posture. Carrying heavy items can cause a problem compressing the area. Hypertonicity of the scalenes or pectoralis minor. Stop all this hunching forward. Roll your shoulders back. Rotate your shoulders outwards. Spread this area out. I can tell I've been hunching at my computer for weeks now, working on these classes, and that when I roll my shoulders back, I can feel, especially my right clavicle, pulling. Keep your posture good. Not only will it open up your ribs to be able to breathe properly, you can hopefully prevent something like thoracic outlet syndrome. All right. Symptoms include numbness of the hand, decreased size of the hand and muscles, usually on one side of the body. All right. It'll be unilateral again because it's not affecting both sides. It's affecting whatever side has the thoracic outlet syndrome happening. Sometimes hand discoloration can happen. It can become a bluish tint. All right. They're not getting enough oxygen. Swelling of the hands, fingers, and arms, especially if that vein is compromised because that blood can't travel back up. All right. Heaviness and weakness of the neck and the arm. Massage is appropriate for TOS, especially using deep or strong pressure. Of course, don't use a deep or strong pressure over the anterior neck. We're not trying to choke our patients, please, our clients. This area is an endangerment site. You definitely don't want to put heavy pressure on the brachial plexus, but you can definitely on the thicker muscles of the area. For vascular cases, all right, for cases where the artery or the vein is compressed, this area is now local contraindication. So if it is neurogenic, if it's a brachial plexus injury, you can use deep tissue in the area. If it's a vascular cause, you cannot massage this area. It is a local contraindication for you. Definitely check them out. You can do an Adson test or the Ruse test, which I have provided for you here. If the client is complaining about any of these symptoms, you can do these tests to see if they potentially have thoracic outlet syndrome, to ask them to please talk to their healthcare provider ASAP. Carpal tunnel syndrome. This is a common one. The carpal tunnel, all right, so first of all, carpal tunnel syndrome is compression of the median nerve within the carpal tunnel, okay? It causes numbness, tingling, and other symptoms in the affected hand. Your tunnel is formed by the transverse carpal ligament, all right, your flexor, and it connects the bones on the anterior wrist, all right? Because this tunnel is inflexible, it cannot accommodate swelling. All right, so it doesn't move. Everything just becomes compressed when there's swelling inside of it, which causes compression on the nerves. All right. So now you have numbness. There's no communication to the hand at all for any type of sensation in the dermatome of the hand, in the skin, in the muscles. It can become not only numb for the skin, but it might be hard to pinch and grasp things as well. Usually this is caused by repetitive use of the wrist, direct trauma, some structural abnormalities. The carpal tunnel is narrower than average in someone, say, like anatomical difference between people. Someone with a much narrower tunnel is going to have more trouble with that. Things like rheumatoid arthritis or fluid retention. Carpal tunnel syndrome becomes much more commonplace during pregnancy because of the fluid retention. And sometimes we just don't know what causes it. All right. Massage and carpal tunnel syndrome. Massage the forearm muscles and muscles in the palm of the hand below the client's pain tolerance. If you do it to their pain tolerance, you can actually cause some additional edema in there and make it worse. Definitely recommend self massage and self stretching to help the clients maintain or improve their treatment. Do not use massage techniques over the interior neck. We already know that. Obviously, there are some really fantastic stretches for this nerve. I have shown some of you. It's where you stretch your arms all the way back. And of course, you can't really see it with my filter. I should probably make a separate video. You bend your hands back and spread your fingers as wide as possible with both arms behind your back as far as possible. Then you're going to raise one up as high as possible, keeping the other one as far back as possible with the fingers spread. And you should feel that stretch, that burning going all the way down here. Now, lowering that hand back to the middle, now you're going to do it with your other hand where you're reaching up as high as you can and as far back as you can with your fingers spread as wide as you can with your wrist as far back as you can as well. And you will feel that stretch in through here. I only recommend doing that once a day because it is a nerve stretch. And of course, we can always suggest that the client does lymphatic drainage of the forearm and cross fiber friction of the forearm muscles are a fantastic technique. Let me know if you guys want me to make some technique videos on these for you, and I would be more than happy to do so. Here's a great test to check your client for carpal tunnel syndrome for you and some research on carpal tunnel syndrome. This is one of those big potential money makers, especially if you're interested in medical massage or partnering with a chiropractor or with like an orthopedic surgeon of some type. This is this and sciatica are your two big boys for nerve impingement and massage therapy being a therapy that can help with those. All right. This last slide here is another test for carpal tunnel syndrome, and I will leave you on that for the day. I'm sorry if this felt kind of whirlwind. I was trying to make it shorter than part one for you. Again, let me know if you want me to make any modality videos where I am showing you how to work on someone with these conditions. I would be more than happy to do so. Have an excellent day, and I will see you guys for the 3.1 lectures.